Aloha, I'm Colin Moore, and I'd like to welcome you to another segment of UHERO Focus. Ruben Juarez, the HMSA Endowed Professor of Health Economics at UHERO and Director of the Pacific Alliance Against COVID-19, is here to discuss the latest UHERO Public Health Report. Ruben, how has COVID-19 positivity changed since the last report?
COVID-19 positivity has increased since the last report. In November, 46% of respondents had tested positive for COVID-19 at least once, compared to 25% in May. Higher rates continue to be seen among younger adults, with a positivity of over 60% for those under 30 years old.
What's the current vaccination situation in the state, and who's received the bivalent booster and who is yet to be vaccinated?
Yeah, so Hawaii has one of the highest vaccination rates in the nation. The overall vaccination rate is over 95%. Unfortunately, only 27% of our sample has received the bivalent booster shot. In addition, only 10% of adults under 50 years old have received the bivalent booster. Native Hawaiian and Filipino have the lowest booster uptake in our sample.
Now, what do we know about long COVID outcomes in Hawaii? Has there been any change since the last report?
The prevalence of long COVID remains high at about 30% of infected individuals, the same rate as in May, no change. Unfortunately, more individuals reported severe or very severe symptoms in the fall compared to the spring. Mental fog and headaches became the most common symptom in the fall, with 59% reporting them. The expected length of symptoms has also increased by almost 1 month since the last report, to 4.5 months.
Now, how do people perceive the risk of COVID-19 now? Do they feel safer than they did before?
Yeah, absolutely. Perceptions of community safety against COVID-19 have increased. 69% of respondents felt safe or very safe in the fall, an 8-point increase since May. Unvaccinated people are more likely to feel safer than vaccinated respondents. Unemployed individuals felt less safe than employed and retired people. In addition, respondents had a more optimistic views of the pandemic in the fall compared to the spring. In May, 76% of people said the worst of the pandemic was over. This increased to 86% in November.
What about so-called COVID fatigue? Who's grown tired of hearing about this disease, and why does this matter?
Yes, signs of COVID fatigue are present in Hawaii's populations. The highest levels were found among those unvaccinated and those vaccinated without booster shots. The lowest score were seen for those with booster shots and older adults.
Let's talk about the ongoing impact of COVID-19 since the May report. How has COVID affected household finances and food security, and what about mental health?
Yeah, the impact of the COVID-19 pandemic continues to increase since May. 29% of individuals in our sample reported having their savings depleted, 14% were unable to pay their bills, and 9% did not have enough food in their household. 4% of individuals lost their jobs, and 7% had their working hours reduced. Food insecurity remained high but stable, same as in May, 8%. In terms of mental health, the rates of depression and self-esteem also remain stable since May. About 1 in 3 adults report symptoms of depression. This rate is higher for unvaccinated individuals and those unemployed.
And how has COVID-19 affected unemployment in the state?
Yeah, we found that in November, an even higher proportion of individuals reported having both long COVID symptoms and experiencing unemployment. Unemployed individuals in November reported a 47% rate of long COVID, a 5-point increase since May. In contrast, the rate of long COVID for employed individuals remained at about 30% in November and May.
Ruben, thank you so much for sharing this important information with our community. This is just a small snapshot of the report. For more information, you can access the full report by visiting the UHERO website.